Are you someone who burps or belches a lot? If it happens very rarely, no big deal. You just drank a carbonated beverage, we understand. But related to hiatal hernia, belching is a real common symptom, and it is related to it in 4 key ways that I'm going to review with you, along with the type of association that you feel with belching and what type of hiatal hernia, meaning what's happening inside your body that's causing this. So let's jump in. Sometimes when people belch, it's very loud. They can be very uncomfortable. My own mom had a hiatal hernia, which I realized in hindsight as I was much older, but she would just be in so much pain, and she'd be massaging, right at the bottom of her sternum where the stomach and the esophagus meet, and then she would let out this sound that was incredibly loud, and then she'd feel better for a while, but it was a very short-term relief for her. So she had it pretty badly, and it was never diagnosed, as many of you can relate to. This was going back in time quite a bit, but it can be very uncomfortable. Sometimes, little burps happen a lot, and those sometimes people, you kind of, you sort of see them make a little motion. They're trying to be polite, so they're not trying to make any noise, but they're kind of swallowing the air as it comes up. But you might know people who do that a lot, in conversation, and you notice them doing that, and they've gotten into the habit of just swallowing the air as it comes up so as not to let out a sound and feel like they're being rude. So let's jump into it. And the first reason why burping happens is that there is a sphincter or valve that controls food going down into your stomach from your lower esophagus. So it's called the LES, which stands for the lower esophageal sphincter. And again, it's a valve that when it senses food or liquid coming down the esophagus, it opens up and then it closes afterwards, and it just has this nice seal that's preventing anything from the stomach going in the wrong direction. But when you've had a hiatal hernia for a while, that pressure of the stomach coming up into the esophagus kind of weakens that valve, so it also lets air go up, and so you can get burping because of that. By the way, there's an upper esophageal sphincter as well, but we're talking about the lower one. The other thing that happens is swallowing air. So if you're somebody who suffers from GIrd, which is acid reflux, or bloating, basically it can cause you to swallow more because your acid might be coming up and you're trying to swallow it, or air might be coming up and you're trying to swallow it, but you're uncomfortable. And knowingly or not, you're swallowing a lot more than typical, and you're trying to clear your throat as acid comes up. And so all of that activity, because again, the direction that should be happening is food and liquid from the mouth down, straight into the stomach. That's it. There shouldn't be any of this from the bottom up motion, and your body knows that. So when that's happening with acid, in particular, you're swallowing, you're trying to clear your throat, and all of this causes air to build up, and the air escapes as a burp. So that's number 2. Number 3, what happens is, again, because the stomach is compressed and pushing up, the stomach isn't relaxed in that position. It's gotten quite compressed, and so its normal functioning of food comes in, the stomach comfortably churns it around until it's broken down enough, digested enough, and then the stomach empties the food into your upper small intestine, and all these processes of digestion and absorption mostly happen in the small intestine. The stomach is more a mechanical churning, although some absorption takes place in it. But when the stomach again is compressed and pushed up, things get a little trapped. So food can get trapped in the upper stomach, air can get trapped in the upper stomach, and you can get what's called delayed gastric emptying. So the stomach, things are not moving through the stomach as well as they should and as quickly as they should. And the gas that gets trapped in the upper stomach has to come back up. So that's another reason that you can have burping. The last one is just the very nature of refluxing acid, bile, and even gas accompanies, those are things that accompany a hiatal hernia. So the acid we know about, but also bile coming from the gallbladder is something else you can reflux, and of course the gas due to the bloat. And then what happens is that again triggers the throat clearing, because things should not be going from bottom up, and again you can be burping up air. So it all has to do with the mechanics of things moving in the wrong direction, but then why. And so getting to the root cause of that stomach being compressed and what's causing that is what's key, so that we can get the stomach relaxed, we can get the diaphragm relaxed, stop irritating the esophagus, and the things that we talk about a lot. So some of the symptoms, if you have belching with heartburn or chest pressure, that's very common with a sliding hiatal hernia. And small to medium-sized hiatal hernias, 95% of the time are sliding. So that's very common. If it's worse after meals or lying down, then that is absolutely an indicator of acid reflux, because the burping is giving you that indication that your food is not emptying from the stomach as quickly as it should, again because things are compressed and elevated, and it's called a stomach displacement, so it's not in the correct position, and that creates the burping. If you have bloating, fullness, or nausea associated with the belching, again that's a displaced stomach. So there's a lot of variations on this. Sometimes people say, as soon as I eat, I just start burping and burping and burping. And so we have that explanation. Or, boy, I really burp a lot when I've got chest pain. So you have the sliding hiatal hernia as the likely cause. So it's all due to an imbalance of how your gut is supposed to work and all the component parts of a hiatal hernia, but I just thought breaking it down might be helpful. Lastly, if you're triggered to burp by bending over or lifting something, what that speaks to is aggravating the increased intra-abdominal pressure that's already part of a hiatal hernia. So we talk about that a lot, is that what has led to your stomach being compressed? What's the source of compression? That is increased intra-abdominal pressure. So when that pressure is increased in the abdomen already, if you bend over to lift something or to pick something up, you're going to aggravate that increased intra-abdominal pressure. So any sort of trapped gas, again, is going to be coming up and the burping will start. So there's several reasons for it, but at the root of it, we have the imbalance that's creating hiatal hernia syndrome. And that root is different for different people. We could sort of summate it in that there's a digestive issue that we've been discussing. There's increased intra-abdominal pressure due to what? Poor diet, infections, toxins. There's a few different things that can create that increased intra-abdominal pressure. The stomach is just being affected by that. It's not necessarily the cause of it, it's more the effect of it. Now, you can have infections in the stomach like H. pylori infections, but that tends to come about later due to poor digestion. So it's not really chicken or the egg. It really does start with imbalanced digestion, then creating pressure on the stomach, and that increased intra-abdominal pressure then sort of cascades into the diaphragm not working well. You feel short of breath. You feel anxious because you're not getting enough air. You're getting heart palpitations because now the stomach and the diaphragm have elevated, and the heart's not happy about that. And then the chronic irritation to the lower esophagus, as we were talking about earlier, upsets your vagus nerve, and that in itself can trigger the heart and the shortness of breath and the anxiety. So there's, you know, a few factors coming into play, and the favorite question that you all love to ask me is, okay, oh my gosh, that's me to a T. What do I do? And I have a love-hate relationship with that question because of course it's the perfect question, right? You know, I just described you to a T. You've been suffering. I understand you want to fix it. So do I. That's what I want for you as well. But there's not do blank. You know, I don't have a pat answer for you because we have to figure out how you got there. And I really want you to know that there is no simple answer. Treatment is not complex. This is the good news. So effective treatment is natural, doesn't involve drugs, it doesn't involve surgery in the main, you know, most of the time, but it's tailored and customized to each person, because what is it about your diet, your health history? How did your gut get in this position? Maybe it's less gut and it's more vagus nerve and structural. Like, I don't know until we get to know you. So I think sometimes people get a little frustrated because they want to just, you know, have me hold up a bottle and say, take this, and this is the answer to your worries. And there are a lot of people on the internet saying, take this, swallow that. And if that was the case, because we've been doing this for 40 years, I would tell you, because I know how miserable this can be. But what we want is full resolution. We want you truly to regain your health, not just get a little relief. And I understand a little relief can be a great thing when you've been suffering. You're like, oh, I'm better, thank goodness, I'll take it, you know? But you deserve full resolution, and that 85% of the time is what we can do. So that's exciting. And if this is you, if you're sort of swallowing those burps, or you come out with a really loud one, or you're really uncomfortable until you get some air out, hopefully I've described what it is, and now it's just a matter of us figuring out what the root cause of your hiatal hernia syndrome is, because that is the most common reason for this symptom. So if you enjoyed this content, please give it a thumbs up. Subscribe to the channel. We're trying to increase our subscribers so that more people can see this information and learn and get help, because that's just the way the algorithm works. So we love your support. I appreciate you very much, and I hope you enjoyed the content. We'll talk soon.